All right, women, when we hit a certain age, we start getting more and more serious about menopause. But did you know, guys go through their own change too? Here with more and how they can help is Ralph Aquino from Essensa Wellness and Aesthetic Center. Thank you so much for joining us. I appreciate it. Now, women get a bad rap when it comes to hormones later in life, but men also suffer from hormonal imbalance too. So what exactly is kind of the men's health focus at Essensa?
Good thing that you brought up menopause, because andropause, that's the term that was coined in the 1930s, because they've seen their wives go through these symptoms that they're also experiencing.
Wow.
So that's why andropause, also male menopause, is related to hormone deficiency.
Right. I think we have a graphic showing some of those symptoms too, the andropause. So there's a lot of, as men age, first of all, we get some of these things, weight gain. Is this just for everybody?
Yes, that is true for everybody. Because
so loss of muscle mass, it's harder to work out. Okay.
Because as we get older, men, as they get older, we lose our body's production of these hormones, particularly testosterone. There's a certain study that showed that at the age of 30, we start losing 1% of our testosterone production every year.
Wow.
And that's continued to decline.
All right, well, let's look at some of the symptoms of the andropause. And a lot of this is the hormone deficiency, like you talked about. We lose these kind of hormones in our men.
That is right. Those are mainly the hormones that declines as we age. And then that's the time that we start having the symptoms of male menopause or andropause.
Gotcha. So I look at those DHEA and, you know, human growth hormone. I don't know what that means. So how does that actually affect a man?
So as we get older, or even during youth, we have these levels at a certain point. We call it optimal levels or the youthful levels.
Right.
And this is the time that we have more vigor, more vitality, more energy. Our sexual performance is much more.
I was going to say, in the bedroom too, we're talking about here.
That is right.
But oftentimes, you know, Big Pharma will tell you, just take this pill. But there's other options.
There's other options. That's mainly taking hormone replacement, or mainly this testosterone or human growth hormone, melatonin, DHEA. There's a lot more hormones that we could optimize for us to regain optimal health and also improve our sense of well-being.
Gotcha. Now we've heard too, like, well, you're getting older, just deal with it. But you really can take a better approach at it. So tell me about this deal that you have for our viewers that you have coming up.
That is true, because there's a frustration of these patients that is increasing because of there's a bad connotation when it comes to hormones, particularly testosterone. Actually, there's a controversy that has, or a recent study that has shown that testosterone is linked to heart disease or even death.
Wow.
But that's only one study versus 40 years of studies and research that have shown protective benefits of testosterone.
Right. So, real quick, we were doing like a medical evaluation, you're doing a weight and body analysis. You're doing a lot of different things when you do this evaluation. So that is fantastic. Thank you so much. So, guys, give Essensa Wellness and Aesthetics a call. The number is 702-888-1037. And like I said, you can get a complete consultation and medical evaluation for only $69. That's actually a savings of $130. You can get more information at EssensaWellness.com.